know that snoring could be a sign of sleep apnea? Hi, I'm Dr. Violet Newman. Proper breathing is essential for a person's health and well-being. During sleep, a lack of necessary oxygen puts a strain on your heart, brain, and entire body, and it can cause serious complications. Sleep apnea affects your brain and the quality of your sleep. We wake up multiple times during the night when we stop breathing, so we can take a deep breath again. We snore, we grind our teeth. It affects heart, it affects our brain, and it impacts the quality of our life. We wake up tired in the morning, we are fatigued during the day. We may experience morning headaches, and it can even impact your athletic performance in a tremendous way. Dentists play a crucial role in identifying signs in the mouth during a dental exam that could suggest sleep apnea. Those signs could be a narrow jaw, an enlarged scalloped tongue, tooth wear, tooth grinding and tooth erosion, enlarged tonsils and adenoids, enlarged soft palate and uvula, mouth breathing, difficulty breathing through the nose, tongue tie, crowded teeth, and so on. Therefore, sleep and airway assessment must be a part of a comprehensive oral and dental exam. I'm here to help. I'm Dr. Violet Newman, caring not just about your teeth, but about your overall health.